you go. Let it all go. Deep breath in. Perfect. There you go. I got you. It goes into an upper back hyperkyphosis. Mm-hmm. So in order to get the head back, your ear should be over your shoulder, mm-hmm. and if you turn to the side, this is starting to round here, and it's common because our world, we have phones and life, and we look down a lot, and we're not being taught how to, prevent our bodies from getting stuck round and forward. It's really about the ligaments on the front part of your body that have to be opened up. And
I feel taller.
You look like it's straighter than when you
Yeah,
came
I feel
in. It looks much better. Good job.
Thank you.
So when's the last time you were adjusted?
In the end of October.
End of October here? Okay.
Yeah.
All right. And what are your migraines, upper back pain, neck pain?
Yes.
How long have you been dealing with?
Okay, so I've had migraines for over 10 years since, probably more than that now, 15. Right around the time when I started having hormonal changes is when I really started having really bad migraines to the point where I had Botox for my migraines, and that didn't help.
When was that done? How
I was 21, so probably like 6 or 7 years ago.
Okay.
I also had like just upper cervical adjustments, just like the Atlas. I had that just adjusted. That helped a little bit, but the rest of my body is still like, my shoulders are like rocks. So it's just like all right here. So it didn't really do much. I didn't notice like that the Botox helped at all. So I just like couldn't move my eyebrows.
Yeah. It's called botulism toxin. Let's inject the toxin into us, and it's like, I don't know.
Yeah, I had like a heart condition at the time, so I couldn't take a lot of the medications because it would lower my blood pressure, and I had low blood pressure but really high heart rate, arrhythmias. So I had SVT, and so I had to have a cardiac ablation. But it was just a big mess.
All right, let me look at your posture. Go ahead and stand up for me. I'm just going to look at your alignment here a little bit. Just get fine. Yeah, so left shoulder is low, right shoulder's a little bit high. You stay right there, you're good. Head's out, a little inch forward. So curve isn't created or destroyed. When we lose our neck curve, it goes into an upper back hyperkyphosis. So in order to get the head back, your ear should be over your shoulder, and if you turn to the side, this is starting to round here, and it's common because our world, we have phones and life, and we look down a lot, and we're not being taught how to, prevent our bodies from getting stuck round and forward. This position puts a lot of stress on your neck and shoulders, and there's not a lot of orthodontists, there's not a lot of chiropractors that want to change posture, and that's what we're sort of here today to do. So we're going to sort of lay the foundation of how do we change posture. The first step is sort of softening up a little bit, getting all the parts of your back working. I'm going to massage you deeply and see if we can get everything moving. Let me have you on your back here for me.
Okay. I also have really bad TMJ, so that probably plays a factor into my migraines. I grinded through my night guard in like 3 months, so then I didn't buy another one because it's $600.
They're all on the same circuit. So when the head goes forward, the jaw gets jammed. So TMJ, migraines, shoulder tension, gastric reflux, heart arrhythmias. The nerves that go to your heart stem from your upper back, and if you have inflammation, we call this the sympathetic nerve. The inflammation of this nerve here will cause dysfunction of your heart because the heart doesn't have any self-intelligence. It listens to what the brain communicates to it. And so my question to the medical world is, is it possible that maybe this is dysfunctioning because the only intelligent thing is unable to properly transmit the intelligent signals? And so it's not a coincidence that you have rocks in your shoulders and tension and pain, and by the way, Ed, my heart's been having problems and all of your organs, and we can go through anything you like. I can explain how dysfunction, irritable bowel syndrome, Crohn's disease, colitis, all these things come from, I believe, inflammation between the brain and the body. Now you're right, if you have a poor diet, that's definitely a piece of it, and so things you eat, definitely inflammation from the foods we eat, but I believe a piece that's not talked about is this communication line. So what I mean by cleaning the spine is we want two things. I want your whole spine to be working evenly. What we tend to find is that this area ages quickly, the lower neck ages quickly, and we have these non-sensitive discs in here that I can't ask you on a scale of 1 to 10 how do they feel. but the discs prevent pain. The discs are these non-sensitive spacers, and like you mentioned earlier, the clicker. What do you want, Dr. Ed? I want your spine to age evenly, and I want these discs to be healthy, but I can't ask you on a scale of 1 to 10, how does your L5 disc feel? How does your, it's not perceivable. It's like, how does your enamel feel? Fine.
Yeah.
You know, you can't really tell me. So how do you evaluate the health of something that has no feeling? Well, we base it on how your back moves. If all the pieces are moving, then we know that your spine's aging evenly. And that's what I want. I want the whole back working evenly. And how difficult or easy it is to bend back tells me bending back actually opens up that disc and allows some nourishment to get into the disc. So if you're constantly forward, the disc is constantly pressurized. About 70-80% of the disc is made of water. So if it's under constant compression, it dehydrates. And real quick, I'll show you. So that disc supports open the hole that the nerve passes through, right? So if that disc becomes compressed, do you see how the nerve starts getting squeezed? And then watch what happens when you bend forward. The hole gets bigger.
Right.
And that's why every elderly person, right, is rounded forward. And that's also something that why chiropractors don't want to do posture change is because your body goes here to get away from pain. Ed, I'm still hurting, right? And you're in avoidance. Does that make sense? So I get to be the bad guy a little bit. Ow, this doesn't feel good, right? Because we're undoing the compensations that your body did. And Ed, I sat in school from 5 till 20.
Yeah.
And life has been here, you know, or down, and I haven't exactly been painting ceilings or stargazing that often. And so, all right, we'll go easy. Here we go. Cross your arms for me. Bend both the knees for me. Take a deep breath in for me. And then exhale for me. Let all the air out. There we go. Let it all go. Deep breath in. Perfect. Exhale. Let it all go. Perfect. Perfect. Yeah, real tight right there. We got work to do. Deep breath in. Exhale. Chin down a little bit. Let the air out. There you go. Yeah. So, some reluctance.
Yeah.
We got... No. If the area moves, you don't really need to work on it that much. It's already working. The areas that you're going to see me picking on, and when you go face down in a second, I use the soft tissue work to make the next time I adjust you better. When all the parts of your back are working, you really don't need to be here. I'm going to teach you how to stretch, and that's how your posture's changed. It's stretching that makes it your current alignment. For instance, your left shoulder was low, I believe.
Probably look in the mirror.
Right. So I know we see it as a left shoulder that's low, but what it really is a right head tilt. When you have an injury on the left side of your neck, you'll tilt your head to the right to avoid it. If I break my left ankle, I'll shift the weight. So your head's in right tilt. This makes you dizzy. If you walk around with your head tilted, you'll get dizzy really quick. So you drop your shoulder to get your eyes on the plane.
Okay.
Makes sense? So when I feel your neck in a second, hey, oh yeah, this is always puffy over here. It's because your head's tilted. So your bottom leg's going to go straight, and then your top leg bent. There we go. Put your hands around your belly. There we go. Perfect. Take a deep breath in for me. Turn your head this way a little bit, and exhale. There we go. Yeah, a little tight there. Other side for me. Here we go. All right, take one deep breath in. You're going to turn your head this way a little bit. Exhale. Exhale. All right, let's go face up for me. This bump right here, that guy. I don't know. What sports did you do? You guys do any like extracurriculars or soccer or
Cheerleading?
Cheerleading. Oh, there's your okay. There had to be something. There's going to be some, whiplash or,
Also, I was a really bad driver as a teenager, so maybe that's well.
My dad wasn't very happy.
No, my whole car was rebuilt multiple times except for the roof.
Oh no.
Yeah.
All right, so maybe some collisions. All right.
Yeah.
All right. Well, the joints in your neck have a lot of feeling, and our posture is, we want to say, when a joint gets inflamed, your body wants to take pressure off of it, and that's what changes your posture. Your body tries to move away from things that hurt, and now because you're in what we call left avoidance, your right lower neck, does that make sense, will age at a faster rate, and so. Let's get a massage for a second here. There we go. Yeah, just this right there. Usually name these after old boyfriends. Oh, no, I'm boyfriend or no fiance or anything? No.
Oh, I have a boyfriend.
Okay.
I had a fiance, so that's probably
Okay.
his fault.
All right, there he is. You're right. A daggone fiance is living in there. I'm just teasing. We'll evict him. There we go. I'm teasing. Here we go. Breathe. Here we go. Let it go. There you go. There you go. I got you. I know. There we go. I got you. Keep that chin up. There we go. I got you. You okay?
Yeah.
All right. Yeah.
Well.
It's been a while.
Oh yeah.
Okay. All right. There we go. Now we're just gonna sort of just soften everything up now. Yeah, there shouldn't be any soreness anywhere. When I rub your neck, when I rub your back, it's almost like there shouldn't be any car dents in your car.
Oh.
Well, there certainly is a lot, but it's not the way it came from the factory. And our spine didn't come from the factory with dings and dents either, unless some of it, like my parents' generation and my parents were forceps babies and vacuum extraction babies, and they literally were denting and dinging these cars right as they were coming out of the factory. But do you know the story? I'm just curious. Do you know the story of your birth? Do you know how you?
Yes, I was a natural birth.
Okay, no forceps, no.
No, nothing,
Good.
no medication.
Good.
Yeah.
Yeah, it was a lot of.
But I was really big. I was like almost 10 pounds.
Oh my god.
My poor mother. She got an epidural with the second one because she was like, I'm not doing that again. Yeah.
I have a patient who has twins right now, and I'm not sure if it's going to be easier. They're going to try to birth them naturally, but like each baby's like 3.5 or 4 pounds, and I'm thinking, okay, well, if you can maneuver them properly, maybe it won't be that bad. Maybe I'm not, but who knows?
Yeah.
Yeah, this side feels wonderful. If you can tell, right? In terms of, and then we got, your fiance. I'm not teasing.
Yeah, that's actually the side I typically have my migraines on.
Feel that?
Yeah.
And actually, how do you want to describe that?
That's like just a knot, just a lump.
Crunches. It crunches.
It's a crunch, yes.
You feel it like.
Yeah.
Right there. It'll go away. But it won't. I was thinking, like, give me an example of a problem that gets better by ignoring it. I'll think about that, Ed. I'll give you, angry wife, air conditioning not working. Just ignore it. You're good. That's not so much. Yeah. So I don't. A lot of these things do not self-resolve. Is my point. And by working on them, we can draw attention to it. Your body will go in there and start untangling it. But because it gets so injured and then it becomes fortified and stiff, there's no spotlight on it. And so we're going to sort of shine a spotlight. And when your boyfriend sees this mark on your neck right here, don't let him call me or,
No, I showed him a video and
right.
I said,
okay.
You wait till tomorrow.
Okay, yeah. There's going to be a, right there.
Yeah.
And that's why your head's tilted. And that's ultimately why the TMJ happens. Your body's in this avoidance. Your body doesn't like to talk to this. And so your head goes forward and it goes to the right to try to get away from this left upper neck. Right.
Have you ever been gua sha?
No, I have a little one that came with like a jade roller, and I try to do it on myself,
It's
but
hard.
it doesn't really work that well. But when I have migraines and my neck hurts so bad, I was like, oh, let me try this, and I was like, it's not really doing anything.
Right there, it's coming out. It's right. In the process of getting rid of this and cleaning it, we do stir it up a little bit, and so this is where some Epsom salt will help later today. Get some Epsom salt on your neck, put it right, sort of like almost like a compress. You take some salt, mix it with some water, get a damp soaking towel and sort of scarf your neck a little bit, and right here, and it'll draw the soreness and lactic acid right through the skin.
Oh, awesome.
There we go. But yeah, that's the injury in there that's causing your head tilt. If we make this area, it's like, how do you fix your posture? You make the area not need to be avoided. Your body will continually want to avoid this. Who wants to spend time in a room that's filthy and filled with glass and broken TV, right? So you go in and remodel the room, and then your body will reside in it. A little deeper here. I sort of just placement test here first. There you go. See, that left side should feel just like this. I mean, just see how smooth it is the whole way down. Just there's no crunch. There's no. This is where, right here is where we can start overworking your spine. That's because your neck avoids the left. The right lower gets overburdened, and so we want to sort of push that rib down here. This gets pinched on the right lower. Right there. so the same thing. There shouldn't be any crunchiness in the masseter muscle here. Tightness in here, constantly jams that TMJ. But the main thing that's happening is the more forward that your head goes, the more rounded our upper back becomes. It's a constant jamming of this joint. So when you open and shut the joint, it is being pressed together all the time, and so it inflames very easily. Drawing the head back is really the only way to absolve it.
And that joint, does it like connect to like right by the ear?
Yes.
Okay, because that's like where it hurts a lot in the morning, and I'm like, okay.
You think you clench all night?
Oh, yeah. I grind my teeth really badly, so.
You have any idea what stress you think, or what do you?
I have since I was like a small child.
Because the guard is for the safety of your teeth. It's really not, doesn't do anything for the jaw joint, the TMJ. It's like, okay, your teeth will survive, but oh my, this poor TMJ joint gets inflamed. All right there. All right, yep, okay. If it's like if you have a clench during the day, you can sort of figure out, you might be able to figure a way to stop it, but if it's at nighttime, I've never, it's like, I don't know, it's just like meditation, or then you're dealing with like trying to not watch anything stressful, you go to bed.
That's why I watch Real Housewives.
Okay. Is that?
It's mindless. You just are like, oh my God, these women.
All right. Might stress me out. I'd be like, ah! But you try to go to bed around the same time.
Yeah.
Don't have, one night going to bed at midnight, one night go to bed at 2 a.m. You're trying to have around the same time we go to bed. A half-hour window is what you're shooting for, and then like I said, an hour before you go to bed, nothing, stressful. And sometimes at nighttime, your body like releases that tension, stress in your jaw. If you're, no Jack Bauer, no news, no, it's all on this left side. Yeah, another little crunch I found here. I don't think it exists. I don't think that exists over here. That makes sense? You got a little bit of a right there. Okay. All right, go ahead and sit for me. Any position that's comfortable. These are the roots of your neck right here. This is also on the left side of your upper back is where the nerves that go to your heart. So I wanted to just check this area a little bit. This T1 through T4 cardiopulmonary nerve on the left side of your upper back is where the communication lines between the brain and the body, and the brain and the heart specifically, come from. And so if there's inflammation in here, we know that you'll have tachycardia, high blood pressure, arrhythmias, and people go to the hospital with these symptoms, and nobody's going in here and checking. Is there soreness in here? Is there inflammation in here? Perhaps, is it possible that the heart's dysfunctioning because, does that make sense? They did the studies in the 50s actually where they took salt, they call it hypertonic saline, and they injected it into every nerve root, and they mapped out the human body. They actually, the first thing they give to, at least my class, when I went to Palmer Chiropractic College, they give you a 50-page study written in like 1950, where does that make sense? They took salt, and like while you're reading the paper, you're like, who would sign up for this? Sign me up for having, so for 20 minutes while the salt was absorbed, you would feel pain.
Right.
In what we call the dermatome, which is a section of your skin that's controlled by the nerve, and then you'd also get visceral symptoms. So you get somatic muscles, visceral organ dysfunction due to nerve pressure. So we've known this for 70 years. We know that. Now, it doesn't have to be salt. It can be lactic acid. You understand? Anything that irritates the nerve can cause this dysfunction. People go, there's no toxins in our back. Well, lactic acid is something that can irritate nerves, and it's a waste product. It's a cellular waste product that accumulates because the muscles are working all the time. Like if you're lifting weights and that muscle starts to burn, that burning is that you're sort of like, there's more exhaust coming out of the engine than can be removed from the area. And so the area becomes sort of toxic, becomes sort of inflamed, and now the nerves are irritated because they're sitting in close proximity to that lactic acid, and nobody cares.
It's like carbon monoxide poisoning.
Right, to the nerve.
Yes.
Yeah, I like it. Carbon monoxide poisoning to the nerve is what lactic acid does. Exactly right. You're doing great. Boyfriend, what in the world happened to your neck? Pretty light. I'm not going that hard. I know you feel like for the camera, people are like, "Oh, what are you ripping our skin off?" I'm not really, right? I'm just pretty light pressure, and it's coming out pretty dark. Just trying to. The lactic acid is permeating the tissue, and we got to rinse this all out of there. I got you, Trina. That's good. Let's go. Here we go. Just testing you out here. Left side's, yep, right here. Got some lumps and bumps right there. I want no soreness anywhere. And we're going to sort of just go through here and clean all of that out. And I've never been accused of going too easy. It's almost always, Ed, back off. And I try to start, warm up and work our way deeper. But all right, yeah, right there. This is sort of the brassiere area. This is what binds up this area, and our world's not giving any solutions. I'm just saying we have to learn how to daily participate in keeping this area freed up. It commonly gets stiff because it's being braced, and we're not being given any solution, to allowing this area to continually move. We're just left to just let it stiffen. And then your lower back, your lower neck, does that make sense, overworks. And so a piece of the puzzle for why you're rounding forward is the tightness in your upper back. And we want to get all the parts of your back working. That's what I checked for in that first adjustment. Part of your back was not very happy to see me, right?
Yeah, and it was like right in here, right?
Right. And so we want to just unlock it. And what we try to do is every visit, you'll, after the first few visits, you'll go, oh my gosh, Ed, my back doesn't have that apprehension anymore. It just moves freely. There we go, right there. Yeah. Okie dokie, Ed. Right there. Right there. Wow. So when you see me hanging around an area, why are you persistent? Why are you... I don't like it. I don't like it. It's not how it was originally supposed to be. And either you tap out or I get satisfied and I move somewhere else, but it's just... There we go.
So how does that feel too?
It probably doesn't feel too good.
No, honestly, it feels
Okay.
good.
You okay?
Because it feels like that's like
Releasing.
I've been like looking for something to like do that. So.
Do you need him to go harder?
We'll go here.
Oh yeah.
We'll get it. All right. She said it.
Oh yeah, I don't tap out.
All right. Well, this is when Ed gets quiet and starts puffing and puffing back here. But, all right, here we go. Yeah, right there. No phone call at 2 a.m. I am so sore.
What did you
What
do?
have you done to me? It was so tender. I didn't do any Epsom salt and I didn't drink any water. And all right. Wow, she is tough. There we go. Arm behind your back for a second. Yeah, there we go. There. Right there. No, he found it. He found the body.
I was just like, I don't tap out. Now I'm like,
Yeah, well, maybe I'll
I regret my words.
slightly tap. All right.
Definitely tell him if it's too much. I tell him all the time.
Mhm.
Actually, I hit him.
Starts whacking me. Get out of there, Ed. All right. Yeah, this is just. I'm not going that hard with the gua sha tool. It's just there's it's like I'm barely running a pass with the vacuum cleaner, and there's a lot of cookie crumbs and Cheerios. That makes sense.
oh yeah.
And then what happens is as we progress through care, you have to all the easy stains are all gone, and all we're left with is the deepest, oldest, stains, and those take longer to get rid of. And the first few passes with the vacuum cleaner, you're getting all the easy stuff. You're getting all the stuff that was just put down, and I call my black belt patients. Either no mark comes out, or all that's left is the oldest traumas. You're good. Once this all flushes out, it's like a whole new person. It's like One time I didn't know I was supposed to change my windshield wiper blades on my car, and my dad gets in my car and he's like, Ed, I can't see anything. It was raining, and I just gotten used to the blurriness. I just gotten used to the poor windshield wipers, and it's like you just get normalized to, and we forget what our back was supposed to feel like, or maybe we don't even remember. It's like that it's not supposed to be so sore. It's not supposed to be. There shouldn't be any soreness. It should just, Ed, can't you push any harder? There's no soreness anywhere, and then from that point we start stretching. And if your spine easily stretches, then you're in the right position. If there's a giant amount of resistance from where you want to be, right, the disparity between where you want to be and where I want you to be, then we know you need to stretch more. And the adjustment is used to unlock your spine so that we can safely stretch without making the loose areas do all the stretching, right? So the difficulty is that parts of your spine are very willing to do all the stretching, right? They're already very mobile, and those areas I really am not interested in making do more work. I'm interested in making all the tight ones do more work, and they're right over the bra strap here, right there. It's just real black right in there, and this eventually affects the breast tissue because the drainage of the tissue is based on mobility, and so when the tissue is restricted and confined, it doesn't lymphatically drain properly. Anyway, we're going to take a deep breath in for me. We're trying to push on this little bump here a little bit. Exhale, here we go. There we go, yes. Oh. Here we go. Exhale. Here we go, I got you, I know. Here we go. We got it moving. Ooh. I know, that was tough. Have your back on your back for me. So the main thing with the hands is that they're one of the most poorly circulated areas, and I think index finger, do you think you it feels odd to me?
Maybe. I don't know. I mean
this one feels a little.
Yeah. With girls like feet being in your hands and like falling on your hands, you just, I don't know. I don't even know anymore.
Testing out my psychic ability, see if I can figure out which ones. That one feels good.
Yeah, that one I broke.
That one doesn't.
6th grade, my first day of 6th grade.
This one feels
Catching a football.
Feels all sorts of weirdness.
Yeah.
Normal. That's odd.
Yeah, the PE coach was like, "Are you kidding me?"
Feels good.
He was like, "This girl, this is gonna be a problem."
I gotcha. yourself above your head on the table. Sort of grab that table for me.
It's
I know,
gonna anchor you.
I'm gonna pull you a little bit.
At home.
There we go. There we go. All right, good. I got you. Uh-huh. Yeah, so this was, oh boy.
Yeah. You should see my knee. It's way worse.
Oh boy. All right. Just gonna see how these all. Mainly care about the joints and. All right. Okay. There we go. All right, go ahead and tilt your head to the left for me. There we go.
I think I heard it.
I heard it in my ear.
Yeah, I heard it, I think.
Tilt your head to the right a little bit for me. Okay, that's great. Okay, it's good.
Cool.
There we go. Good. Press back. There we go. Yeah, here's a real super loose. Oh my goodness.
Yeah, as soon as you were like, press back, I was like, okay.
We gotta keep those shoulders down. All right, let me show you a few things. Go ahead and lay back for me. I got you. Arms above your head for me. There we go. Head back for me. There we go. Good. Get the idea. We have to start stretching. Oh, I know. Pressure up here, right?
Uh-huh.
Pressure here, and then eventually you start working it down. But this is becoming rounded here. It takes about 20 minutes of time to change your posture. Everything I do on that table is to make this posture changing possible, right? Otherwise, Ed, I can't do it. It hurts too bad. If your hands go numb, you're gonna have to put them to the side or put them on your belly. But we're trying to, that makes sense?
Yeah.
Press this area in and counter stretch. Pressure here. Does that make sense? And then that stretches that in.
Yeah.
It's really about the ligaments on the front part of your body that have to be opened up. And
I feel taller.
You look like it's straighter than when you
Yeah.
came
I feel
in. It looks much better. Good job.
Thank you.
Thank you.